Excellent.
I'm Jim. How are you,
How
sir?
you doing? So Australia. Did you come all the way from Australia
Yes, I
for this
did.
meeting? You know, we could have
One of them, yeah.
FaceTimed you. We could have FaceTimed you. It's all right.
Probably would have been asleep.
We're in Australia.
Byron Bay.
How long does it take to get to Australia?
My travel time is like 21 hours.
It's gonna be hard going to see her.
Yeah.
That's there's a bunch of places on my list. Australia is definitely one of them. I think Japan and Egypt are at the top for me. I don't know how safe it is to go to Egypt though.
Me too. I want to go to Japan and Egypt as well. That's the list.
But then Australia, I figure if I go to Southeast Asia, then I can swing over to Australia.
Yeah.
But let me fire up the
You surf?
computer here. No. I do not surf. I can't even swim. You know that dead man's float? No, I'm a dead man. You know when that happens.
You
I
sink.
fly forever. You know,
You sink.
I sink. I am like concrete blocks. And when I was a kid, I figured I was just scared of the water, and that's what everyone attributed. Now I'm not scared. I'm like, oh, I love the water. So why the heck can I not float? You know? But so, I put you in the hands of Dr. Nine. Nice guy, right?
Really nice guy.
He's just like,
Yeah.
and so our last kind of correspondence when you had called over was like, well, I think we've got to decide whether he told me, look, scans, I see the scans, but can't be sure. I want to go in and make sure that there's nothing else going on. Did he follow up with you on that?
He did, and said that they'd come back negative.
Everything looked clean, right? And so there was the fluid that was taken out, there was no cancer in there,
Right.
and he biopsied the pleura, and that was negative,
Right.
correct? And so what did he talk to you about in terms of strategy?
Did not really anything. It was a nurse practitioner that was on the phone.
Uh-huh.
I thought that's what our meeting today was about. You know, when you and I had met in the beginning, you had mentioned that the cancer was in that one particular area, and that there was a chance there could have been more there, but you had mentioned that surgery was an option to go in and just remove that cancer. I think since
She
then,
said it was too dangerous to
I don't
take it
know,
out.
Tatanina or somebody said it would be too dangerous to go in to do that. Do you have any update on that at all?
So, when did you last see the follow-up? Oh, here we go. This is the hospital though, but have you followed up with them in the office since then?
No, they called to set a time to take my stitches out next week.
Okay. And what I will do is, let me double back. You know, he and I had a conversation over a month ago, just when he saw you.
Right.
And so let me double back with him. And so, I mean, you went for this. He was saying that removing just your lung and was going to be too dangerous from a respiratory standpoint.
Yeah, he said it was too close to the esophagus and there was too many blood vessels. Even the nurse said it before you were going into surgery.
Yeah.
They already knew that before you even went to surgery.
Let me double check here. Because otherwise the option would be chemotherapy and radiation. You know, the combination of that. You know.
Are there any other options than those, like medications or anything?
No, not for lung cancer. Not for lung cancer. There are oral drugs available depending on the type of cancer it is, but that's generally reserved for a stage 4 setting.
Okay. Like that Keytruda.
So Keytruda is immunotherapy.
Yeah.
Now, Keytruda is used for stage 4 cancer, but now is also being added to chemotherapy and radiation up front to try and shrink tumors down with the goal of trying to shift towards surgery. So those are all options.
Yeah.
Okay. And so yeah. And so this was done on, let's see here. Right. So you had surgery. Oh,
Thursday.
God. Holy moly. my man, you're looking great.
Mhm.
You did a whole lot better than I would have done. Is this last year? No, it's this year. What month are we in? September. So this is dated the 31st. Wow. Man, you look great.
Mhm.
Let me take a look at some of those incisions. Can I take a look?
Mhm.
Yeah, that's a good idea.
We do need to get you healed up before we
Yeah.
start anything.
Yeah.
Take this shirt off.
We've been red. We've been washing
Oh, look
it,
at that.
but
Okay, so take some of these stitches out. Wow, that's pretty good.
okay.
Great. You know. Awesome. Just a little bit of redness, but nothing like
Yeah.
Yeah.
overwhelming. Keep an eye on this lower one. I'm sure when the stitches come out, it'll be less irritable.
Okay,
As
yeah.
long as
It
there's
looks
no
tight.
discharge.
It looks
I'm no
really
surgeon,
red.
but yeah, it looks. Do you have any sort of? Did he recommend any sort of antibiotic ointment or anything?
No,
I'll take
he
a listen
hasn't.
to you as
I
well.
haven't spoken to
All
him
it
at all.
said on the sheet was soap and water. Not even like antibacterial.
That's fine.
Soap and water, is that?
Yeah. That's just what I've been doing when I'm with him. I don't know what you've been just
I
showering.
can't get to it,
You
you
can't
know.
reach
I
it.
mean, I
Do you
just.
have, buddy?
Oh, Dad, you can go like this. You know,
Do you have?
squeeze. Number two.
All right, thank you.
I mean, I reach around, you know,
You need to at least.
when I rinse the thing out, it lets it down. And
Yeah,
so
yeah.
it goes over it.
Yeah. That and I'll wash it.
Rick, when do those stitches come out?
Next Tuesday, or the Thursday,
Do you want to
Who does that?
the doctor.
And doctor or the
Yeah.
PA. You know.
Do you think we should put anything else on it because it's red, like Neosporin or anything, or no? Just leave it.
Just keep an eye on it.
Okay.
So yeah, so in terms of treatment, if we're not going to go to surgery, you know, you had what we felt was stage 3A malignancy. Okay, and that's what we were looking at originally, and so you know the standard of care for that is chemotherapy and radiation up front, and then following that up with 1 year of immunotherapy, which is the Keytruda that you're talking about. You asked me about. So before we would just do chemoradiation and then give you a little bit more chemotherapy and just leave you alone.
Yeah.
But the idea now is that immunotherapy, after you get the chemoradiation, can really reduce your risk of recurrence over and above just the chemotherapy and radiation alone. And the nice thing about that that immunotherapy is it generally is very, very well tolerated. You know, very small minority of patients suffer significant sequelae, and there are significant potential sequelae, but generally the overwhelming majority are tolerated very, very well. You know, that's after the chemoradiation. And just looking back at your stuff here, probably what we do is just give you a weekly chemotherapy in conjunction with radiation therapy, something called carboplatin and Taxol. Okay, do that once a week. That's not too intense, you know, and then provide you with radiation therapy, and then
You just go in for a period of time, like an hour or whatever.
literally it's a couple of minutes for radiation therapy.
Okay.
Really?
It takes longer to kind of get you set up. You know, I think they do like 30-minute slots here. You know, getting patients in, set up,
Yeah.
and get their radiation therapy. And the chemotherapy is once a week. It's a couple of hours. You know, once a week during the course of radiation therapy. So about 6-7 weeks afterwards. So we give you some time to heal up a little bit and recover from the chemoradiation. Generally, insurance likes us to confirm that there's been no evidence of progression prior to starting immunotherapy. So,
Okay.
yeah.
When do you go back in to see if it's progressing, if it's gone away, or
So at the end of the day, we have to finish your chemoradiation and get that set of
you
imaging
gotta go through
to
that whole
make
process?
sure it hasn't progressed, and then, you know, when you do chemoradiation, I liken it to like, you know, cooking a piece of meat, right? Basically, we're gonna cook this tumor, right, and all these tumors, and then, you know, when you're cooking something, you put it in a pan. What do? So oil helps get a good simmer, and you get better response rates and better outcomes. And so it's just a little bit of oil in the pan. We're not deep frying the turkey.
Yeah.
And so that's the carboplatin and Taxol.
Mm-hmm.
And you don't have any numbness and tingling in hands and feet, do you?
Mm-mm.
Do you?
My feet, I've had numbness for quite some time.
Yeah.
Yeah.
Well, do you know what that's due to?
I think it's a lack of blood flow, blood circulation.
Drinking.
Well, the thing is, if it's numbness and tingling, the chemotherapy can make that worse. And so we have another option. Instead of carboplatin and Taxol, we give something called carboplatin and etoposide. That's a little bit more intensive. Okay. And that's given, the carboplatin is given once every 3 weeks. The etoposide, the etoposide is given 3 days in a row. And generally when we do, there are a few different schedules of that, but we can consider that as well. So if you never had this neuropathy worked up, you don't know if it's a vascular issue, you don't know if it's a nerve issue.
Mm-mm. Mm-mm. Never
What
really
did they
had-
call it on your
Yeah.
chart?
No.
Something P, peripheral something.
No, you're thinking about,
That's what they said for your legs. It was a peripheral something.
term to do with blood flow. Neuropathy.
That's what
Do
you
your
just said. So I
calves
think it's the
swell?
peripheral vascular something.
No. It's just like, right now, my bottom of my feet are a little numb.
When you
Yeah.
press on your calves, does it leave a dent?
No. Mm-mm.
So that may be something to consider.
Okay.
A
So that
change in the chemotherapy.
etoposide, that one's a bit harsher.
It's just a little bit more intense, yes. 'Cause
Okay.
the nice thing about carboplatin and Taxol, it's nice to give on a weekly basis. The traditional way of doing, actually, if we're treating you with curative intent, we are actually, we give something called cisplatin with etoposide, and so that's given, basically, it's the cisplatin's on day 1 and 8. If you're looking at 1 through 30 in terms of the month,
Yeah.
you get cisplatin on days 1 and 8 and the etoposide 5 days in a row on the first week. And then you do it twice, basically 2 months of treatment, and that's during the course of radiation therapy. That's what we would do.
Okay.
And otherwise, you're a robust guy, my man.
Mm-hmm.
You'll be able to take it. I
Yeah.
have any doubt
And I
about
can
it.
schedule this at the facility up off McMullen Booth, which is close to my house.
We can.
So do you think?
Now,
so
the only thing is radiation would be here.
Oh, would it? Okay.
Yeah. If you want to see an outside radiation oncologist closer to home, we can arrange that for you.
No,
But
that's fine.
I prefer to have,
No,
really, if there's a problem, I want to be here to handle it.
no, I get it.
You know.
Yeah, I get it.
So-
I don't mind that. That's not a problem.
So surgery is 100% not an option. I mean, that was just from the doctor that we heard. But what do you think? Is it 100% not?
I'm not a surgeon,
Yeah. Okay.
so I would say that if he thought that was very high risk, I can rediscuss it with him.
Yeah.
But I would venture to say that probably end up just doing chemoradiation followed by immunotherapy.
Okay.
Okay.
One
Because let's
thing-
just say if those locations, if they scar up, let's just say,
Yeah.
trying to go in there, it's still dangerous to go in there.
Yeah.
If they said it was really close to, certain areas that were going to be difficult for him. When you radiate areas, you can create scar tissue, and surgeons generally don't like to operate on radiated tissue because it's a box of chocolates,
Yeah.
So yeah.
Okay.
But I'll double back with him, just make sure we concur with him, which will be, but the standard of care would be chemotherapy with radiation.
Okay. No other options. That's just the straightforward way
Followed
to do
by
it.
immunotherapy.
Yeah.
It's the, so, I mean, when you ask no other options, there are all kinds of options. You can choose to do nothing. You can choose to try and take a pill, but that would not be curative in intent.
Yeah.
And, and everything that I do is guideline based. It's not that I'm just saying, oh, why don't we do this?
Yeah. Okay. Okay. And then when would he kind of like start the chemo? Like as soon as
I want you to
possible?
heal
or-
up. I think we need you to see a radiation oncologist. We can set you up to see Dr. Griffin here. You need time to heal up, and then we have to get the radiation plan together, and then and then we want to place a port for you. Also, we can have that done if you live close to McMullen Booth. There's a place there called Advanced Imaging 3, AI3, where we can have your port placed there. Easy to do.
Yeah.
So what I'll do is I'll touch base with Dr. Knight and just to make sure that we confirm that he wasn't thinking something else. And we have, like sometimes there's a misunderstanding when you're counseling patients.
Yeah.
And I just want to make sure that there is no misunderstanding because sometimes.
Yeah, because my thought was that if we can go in and get it, let's go get it, but again, I don't know what the risk,
But again, I'm relying on you. I see what was documented, that he would go in and take a look and see what was there.
Yeah.
That's what he's documented. He didn't document what he told you in terms of your risk and whether you were a surgical candidate or not.
Yeah.
Yeah. Okay.
And so that's why I'm relying on you. What he told you directly is that if
Yeah.
you were too high risk and he would not recommend surgery.
I don't
So
know where he would
They
have
said
told
he
me
was-
whether-
It was before surgery. They gave you a Valium. You were half asleep.
Okay.
One of the doctors said it, and then he said it as well.
Okay.
But they also said he was really conservative. But I mean, I do trust him. He's
Dr. Knight
really
was
good.
conservative.
Yeah, conservative with taking too much or taking
Well, look,
things. That's what the nurse
what you
said.
don't want is you don't want a cowboy coming in there and
Yeah.
shredding you up, for lack of a better term.
Yeah.
And
No, I trust his judgment. I was just, yeah.
so once you heal up, once you see a radiation oncologist, right now I'm just going to preliminarily enter a regimen in there to start in early October.
Yeah.
Okay.
Okay. So
Like
early
October 2nd.
October.
And I'm going to see if we can follow up with you here, make sure everything's good to go, like the Friday before.
Okay. And what do you think about? Okay, so he's still smoking and he drinks quite heavily. What is that gonna do, like, to the treatments and what's going on, or how is this? Can you explain to him, or I don't know.
Sure, you really just got to slow that down. Basically, you're. Some would argue it's too late to have lung cancer, but you continue to feed the fire. Okay, and then with the alcohol, just in general, how much do you drink?
A couple a day.
3 big ones a day.
Big
It's,
ones, not big ones.
I would really slow that down.
Yeah.
And my man, I hear you. You got a wonderful family here that cares for you. But at the end of the day, you got to look in the mirror and come to a realization
Yeah.
that you're beating yourself up.
Right.
Okay.
it's just gonna make it harder, right? Yeah.
Can you prescribe me Wellbutrin?
For
Well, my ex-sister-in-law
Yeah.
took that, and that's what helped her.
And I think there's a little bit of depression. So yeah, I think something like that, where it would help the drinking, the mood, smoking.
I'm sure
any
you
of
want to
that
add
would
something
be-
in like that right now.
Well, what do you think?
We can all try it. But in terms of the smoking, at the end
If
of
it's
the
the
day,
only way to like help him quit or
You
slow
know,
down.
here's the thing. When it comes to smoking cessation, you just got to be ready here.
It is.
No drug
Oh my
is
God.
going to help you if you are not ready here.
Mhm.
Okay, I don't want to say that smoking isn't addictive, because it is addictive. Alcohol can be addictive, but it took my father, about a colon cancer. He smoked those more menthols. I don't know if you remember these more menthol smokes at the 100. He smoked a pack of those, 2 packs of those a day. Ended up getting colon cancer. He looked at me and says, "All right, I got to stick around here." So he chewed juicy fruit for a week and stopped after that.
Yeah.
That
It
was
is a mental thing.
purely mental, and you were dealing with that
Fixation.
fixation of. So instead of putting a cigarette in his mouth, he put a stick of juicy fruit in his mouth. And I remember all these bags of gum wrappers, hospital while I was trying to quit. Took him a week, and was done. I picked up the cigarette again. But at that point, you made up his mind. If you haven't made up your mind, there's no point in putting you on anything, as far as I'm concerned. You know,
Okay.
because look, if people want to stop smoking and just took a pill, then
Everybody would be doing it,
they'll
yeah,
be doing it.
of course.
You know. So we can always do that, but you know, I think it's kind of pointless if you're not.
Fully in, yeah,
Because you're gonna come back and, well, I took a pill and I can't stop smoking.
yeah.
No, that doesn't.
And he was getting nightmares on the Chantix. I don't know if that was like,
Then what I would do is talk to your primary about other options. That's what I was thinking. Chantix is the normal one.
yeah,
You know, but again, you gotta be ready. If you're not ready,
yeah. Okay, thank you for that.
What are some common side effects from the regimen of chemo radiation that you're outlining?
so mainly it's the ones we get most concerned about: nausea, vomiting, diarrhea. They can make you tired and suppress your marrow. But generally these days, I don't worry about the nausea anymore because the drugs that we have are amazing at combating it. Okay, really, really excellent.
Suppressed marrow, what's that? Bone marrow?
Because remember, chemotherapy kills fast-growing cells.
Yeah.
Your marrow is very high turnover, so cells will go down.
Okay,
You know, just have to be mindful to look out for infection.
okay.
And you know what? You don't have any kidney dysfunction or ear ringing, do you? Because the cisplatin can cause some kidney dysfunction and ear ringing, but the way we have it dosed, you'll probably be okay. Okay. Let me just print out some. Some stuff for you here. So I'm just checking who's here.
How about some of his vitamins or like things that he was already prescribed plus some? And I almost wanted you to take a look to see if they're all right with everything. I mean,
What vitamins? I'm sorry.
well, on his prescription, it says that he needs to take the omegas, which he has, the B complex D3. And then I have him taking like zinc and milk thistle as well. And I just wanted to see if that's all right.
I would say this. I gotta go to a different printer and stuff now. But at the end of the day, when we have chemotherapy, I'm not sure how zinc will interact with that.
Okay.
There's really no reason to be on zinc. Okay. So you know, I would just kind of stay off of stuff. A good
Extra stuff.
multivitamin, yeah. Milk thistle, is that because we're concerned about liver function?
Liver, and then I have another liver thing, yeah.
So I don't know how that may affect the way your liver processes chemotherapy.
Yeah, okay.
You know, so I admire the proactiveness. I think after we do that, you know, if you want to
Maybe
pursue those
after.
things, I think it's
Okay.
very, very reasonable. It's just I don't have enough research to tell you. You don't research how, you know, treatment interacts with this, and if we potentially affecting liver function,
Yeah.
you know, zinc. You know, only time I think I've heard of zinc being used is for wound healing issues.
Yeah.
You know, but otherwise, I don't know if it messes with anything. I just don't. So I try and minimize things
Yeah.
while we're on chemo radiation. You know,
Okay.
I had a lady getting cancer treatment. She said, "I'm nauseated every morning. Nauseated every morning." Why? I said, "I don't know as well. I don't know if it has to do with my supplement." She took 30-something supplements every morning.
Well, yeah.
And I
That
said,
is nauseous, yeah.
I said,
Yeah,
you know, that's
shocker.
probably what's causing the problem. And I said, you know, she was spending hundreds of dollars and stuff that had no high level of evidence to support it, you know. And I love the proactiveness, but, you know, we're moving into areas that don't have a very, very high level of evidence. Um, but you know, we're always trying to optimize our health, and I appreciate that. You know, I do. You know, everything, like I said, we do here is, you know, FDA regulated. You know, it's paid for by insurance because there's evidence for it. You know, that's medical care here. You know, a lot of this other stuff with the supplements.
It's not regulated.
It's not regulated. It's all out of pocket. And there's a reason for that because it's not considered standard of care. So, but I think eventually, if we can do better research on it, the problem is no one's funding that research. U.S. government isn't funding that research. You know,
Yeah.
and occasionally you can incorporate things into clinical trials to see if it helps. And you would think that natural stuff sometimes helps, but it's actually, there have been studies to show that there's been detriment. There's a study incorporating vitamin A because they thought that might be protective against lung cancer in patients who smoked. Turns out that it was more detrimental. More patients got lung cancer taking vitamin A than they did, you know, than those who didn't. Is that random? Maybe, but you got to study that.
Yeah, that's true.
So right now I am making an appointment here for the 29th, okay? And that's just to make sure that everything is ready to just have a placeholder. I'll have you.
September?
September, yes. And you'll see my nurse practitioner, Madeline. I'll be here, but you'll see my nurse practitioner, Madeline, who can finish counseling you on all this
And
stuff.
what's the purpose of the next call?
I'm sorry?
It's the